Okay, well, good afternoon, and thank you all for joining us. My name is Julie Cronin. I'm the president of the American Nurses Association, Massachusetts. I'm also a registered nurse, and I'm a nurse director in oncology at Mass General Hospital. Welcome to the second offering in our webinar series, Commonwealth Conversations. We are so delighted and grateful to have Massachusetts Health and Human Services Secretary Marylou Sudders joining us in our conversation today. Thank you, Secretary Sudders, for joining us. We are truly so appreciative to you for taking some time to speak with us this afternoon/evening. Our goal today is simply to have a conversation about some of the pressing issues that we're facing in nursing and healthcare within our state. And so first, we just like to take this opportunity to congratulate you and the administration on the landmark healthcare legislation that was recently passed, which streamlines licensure requirements before independent practice and makes permanent expanded scope of practice for nurse practitioners, nurse anesthetists, and psychiatric nurse mental health specialists. We believe that removal of antiquated physician oversight language will ensure that these advanced practice clinicians are able to practice to the fullest scope of their education and training, which includes issuing written prescriptions and medications and ordering tests and therapeutics. So thank you. We are also particularly pleased at the designation of a permanent seat for a registered nurse on the Massachusetts Health Policy Commission, which has been ANA Mass's legislative bill sponsored by Representative Khan and Senator Lewis for several sessions. So we believe that having a registered nurse on the Health Policy Commission will assure that the voice of the nursing profession is heard when making important decisions regarding the delivery of healthcare in the Commonwealth. So just a quick note about ANA Massachusetts. We are a constituent member of the American Nurses Association, and we represent all nurses from the bedside to the boardroom. And so as an ANA Mass member, nurses have this unique opportunity to do things like legislate for policy that affects them in their daily practice, similar to the two items that I just mentioned, attend educational conferences, as well as to network with other nurses throughout the state and the country. So with me today, joining us in our conversation, we have three ANA Mass members who are also direct staff nurses, and they'll introduce themselves prior to asking their questions that either they've devised or that were submitted ahead of time through our ANA Mass membership. But first, I'd just like to turn it over to you, Secretary Sudders, for any opening remarks. And for our viewers at home that perhaps are not fully aware, we were hoping you could provide a brief bio and just give us an overview of some of the roles and responsibilities that you have as Secretary of Health and Human Services, and what does it mean to supervise 12 agencies in the Mass Health Program?
Well, first of all, thank you. Good New Year to all of you, and I hope everybody is well. I do want to just start by thanking the nurses from the bedside to the boardroom for all that you do, for helping to carry the the scope of practice legislation across, as part of the healthcare bill, across the finish line. It's been a priority of Governor Baker for several years. We had it obviously in his healthcare bill and the like. And I do once remember early on in my education as being secretary of understanding the scope of practice limitations for our nurses, of having a map of the United States and showing basically, I think it was Massachusetts and Mississippi were the only two states that had not eliminated these antiquated rules. And I remember being in the governor's car with him one day, and I literally taking the map and putting it in front of him and saying, Governor, we're competing with like Mississippi here. We're bottom of the class in terms of nurses practicing at the top of their license. And that is when, so this is a number of years ago now, and that is when we just started to really, I think, you know, we've been full partners with you on the scope of practice, and we were pleased to see that as part of the healthcare bill that he signed into law. And thank you for your advocacy on that. So briefly, thank you for tolerating a social worker amongst you. So professionally, I'm trained as a social worker. It's been a long time since I've been a clinician, but you know, you carry those clinical skills with you throughout your professional journey. I've often said my group work skills have never come more in handy. As being secretary of half of state government, it's actually, I'm responsible for about 54% of state government, about $25 billion, 22,000 public employees,
Wow.
I tell the governor it's the best part of government because it is the part that truly touches health and human services. 1 in 4 residents are directly touched by some part of what I'm responsible for. And if you think of some of our public health programs, of course, right now I know public health nursing is represented in the ANA. If you think about public health, every community is touched by some part of what we do. I take the responsibility very seriously. I can rattle off a bunch of numbers, you know, about budgets and agencies, and but as a social worker, and I know it's also true for nursing, I know that behind every one of those numbers is a person, a family, a community, right, with hopes and dreams. And it's our opportunity and our privilege and our humility that helps find those pathways. So it's actually this week, I think it's this week, could have been last week. It's a pandemic, so I'm not always oriented to every day because it feels like one long day since last March.
Yeah.
But I just had my 6-year anniversary as being appointed by the governor. I came in with him in 2015. And in addition to that, I am his point person for the COVID response. So since March, in addition to being secretary, I also have this dual role of helping us work together through this extraordinary pandemic. And I'm grateful to all of you for what you do, because it's the pandemic we're all tired, we're weary. I do see the light at the end of the tunnel, and it's not a train coming at me, but it is, right? It is hopefully safe, effective vaccines that we can help people feel comfortable accepting when they're ready to accept the vaccine. So, yeah. And the only other thing I'd say is, as an inaugural member of the Health Policy Commission,
Yes.
so I was appointed by former Attorney General Martha Coakley on the original Health Policy Commission. I actually think having some of us who have a clinical background and having someone with a nursing background helps to inform our public policies, not just by economists, but those of us who actually implement those policies into clinical practice. So I was pleased that that also came over the finish line. So with that, I look forward to your questions. I always refer to these as stump the secretary time.
We'll try to go easy on you.
I'm really grateful for the invitation.
Thank you so much for that. That was so well said. And I think I totally agree that once you're a clinician, you always carry it with you. And I love what you said about every person, every family just has a story and has their hopes and dreams. And you can really feel that you are committed to the work. So that's quite an enormous scope. And you mentioned that we're all tired and weary, which I think we would all agree with. I guess just a brief follow-up to that would be, you know, what's it been personally like for you over the past 10 months, almost a year? How have you been able to care for yourself during this time?
Well, I'm probably better about talking to other people about taking care of themselves, as I am. I often say to the people I'm privileged to work with, please, you know, take care of yourselves, because if you don't take care of yourself, you can't take care of other people. I feel very fortunate to work with public servants who are extraordinarily, one, they're subject matter experts in their fields. Two, you feel their connection to people and the people we're privileged to work with. And they are working around the clock. On this past Saturday, for example, I was on the phone with the head of a very large company, and we were trying to have a conference call that day at 3 o'clock. And the individual reminded me it was a Saturday, and I reminded him that it was a pandemic. I meant it kindly, but it was, we don't have the luxury of time in a pandemic, right? To keep working. So one, I get my energy from the people that I work with and the issues And I have to say, Governor, this is not a political statement at all. I'm an independent working for a moderate Republican in a heavily Democratic state.
Right.
Governor Baker is, who I've known for a long time, is like my best supporter. I go to him with, as you can imagine, many issues, many of which are not popular, feel good kinds of issues, and he's right there. I appreciate that in our chief executive. It's not political. It's about what do we need to do right by the people of Massachusetts during a pandemic, and so that's helpful.
That's great. We had the pleasure of speaking with the governor a few months ago, and can definitely feel his commitment. And so we really appreciate that. So thank you for that. I'm going to start our Stump the Secretary, and I'm going to turn it over to Eels for our first question.
Good evening, Secretary Sudders. My name is Eels Pierre-Louis, and I am a recently appointed member of the ANA Mass Board of Directors. I am a clinical coordinator of maternal fetal medicine at Women and Infants Hospital and a psychiatric mental health nurse at Bradley, both located in Rhode Island. I'm currently pursuing my master's in psychiatric mental health nursing at Walden University. Based on your background and accomplishments in your current role, it is clear that you are a strong advocate for social justice. COVID-19 exposed the reality that systemic racism has led to longstanding inequities in healthcare and striking disparities linked to COVID-19. Both Black and Latinx individuals are now dying at a 2.8 times rate higher than white people. Lack of trust in the government and medical establishment in Black and Brown communities is a result of historical atrocities, such as the Tuskegee syphilis study. Despite effort from the pharmaceutical industry, healthcare providers, and community leaders to enroll people of color in the vaccine trials, many members of the minority community have indicated that they do not trust the safety of this vaccine. Secretary Sudders, I have a two-part question. The first is, what is your response to members of the Black and Latinx community who ask, should I take this vaccine and why?
Is that the two-part question?
The second part is, what steps has Massachusetts taken in determining the prioritization of this COVID-19 vaccine allocation? And do you think transparency in the decision-making process was achieved?
Thank you for that. And thank you for being a psychiatric nurse, Andrew. You speak to my heart. My whole background is both personally and professionally in mental health. So thank you for your work. I would be grateful if, in looking at the cameras, the governor and I talk about this a fair amount, that here we are, two white people standing in front of the cameras several times a week, talking about vaccines and COVID and the like, and assuming that that is accepted by individuals, members, populations of color. And we know that that is not, that we are not the effective communicators in that space. Because of the longstanding institutional racism that has existed, and the fact that the healthcare system has disproportionately impacted individuals of color. So I would love to say, I know as a white woman social worker that I am an effective communicator, and that just is not the truth, cannot be the truth. So one, we have been identifying throughout Massachusetts individuals for whom are trusted members of communities, to be individuals who can be the bridge of longstanding mistrust and distrust with the scientific and medical community. That is, I think, one way to try to bridge what has been a divide. So that's one. And I'll give you some concrete examples. SEIU local 1199, which represents a very, so the personal PCA community, a lot of home health workers and the like, very large union in Massachusetts, very much represented by individuals of color, reached out about town halls. And so literally through them, through their union, not us being the sponsors, providing individuals from their community to talk with one another, plus some medical experts to support them in just providing what you and I would think of as basic information. It's just one small way of trying to find a bridge here. Reaching out, and I think some of you know, our vaccine advisory board was not solely composed of individuals who were from the medical fields. It very much represented communities of color. The one I always think of is the Reverend Liz Walker, because I always feel like she just preaches in a way that is both confrontational but accepting, if you know what I mean, like sort of challenges and then brings you in, but across Massachusetts, because that is what is going to change this conversation. So as we think about, this is a long answer because this is so important. It is going to be a lot of finding communities that are identifying, it's not finding, identifying individuals within community to speak to community. And it's going to take longer around helping people feel comfortable to make the decision to accept the vaccine or not. And it is one of the reasons why we talk so much that this is a voluntary vaccination program. So this is different than just big media campaigns and PSAs. This is much more community to community, as we have done in Massachusetts around health insurance access, for example. So I'm proud that we have the greatest number of people with health insurance, but we had a very large number for many years of individuals from the Latinx community without insurance. And the helping individuals trust government to sign up for health insurance was a very different kind of engagement than what you would do for other communities. So I know that's a long-winded response. It's extraordinarily important. And it's everyone communicating about it. On the disproportionality, so as we do sometimes in Massachusetts, when we were discussing the vaccine rollout, there were three major goals, and they're all equal. One was to preserve to our healthcare community, right? Our front door, to ensure the preservation of our healthcare community. A second one was equity, that our distribution had to be through the lens of equity. And then the third was obviously to preserve life. So the equity, unlike most other states in Massachusetts, when we identified COVID facing, so we divided COVID facing healthcare workers and non-COVID facing healthcare workers in our first phase, and defined COVID facing healthcare workers very broadly. It's not just direct care staff. It includes environmental services staff, includes food, dietary staff, technicians and the like. And that a little piece of that, not a little piece, a big piece of that is equity. It makes it a little bit more difficult to roll out vaccines, but that is the struggle we need to work through in Massachusetts. You see that also, we moved home care workers, home health into our first phase, because again, to us, that is an equity issue. So, and when we get to phase 2 and 3, 20% of our allocation of the vaccine goes to communities disproportionately impacted by COVID. Now, again, there are operational challenges around it. Those are the right operational challenges to have. And we put out a dashboard where you can hold us to what, including ethnic and racial distribution, that people can hold us to this, because its transparency will help us bridge, I hope, some of the distrust. But I have no illusion that this is an easy conversation.
Thank you very much, Secretary.
Thank you for what you do.
I appreciate that.
Thank you, Ilse. Hello, Secretary Sudders. My name is Regina Mood, and I'm one of the co-chairs of our Health Policy Committee. I am a registered nurse, and I work at South Shore Health as a nurse case manager. I'm also pursuing my master's degree at Southern New Hampshire University and enrolled in the Nurse Educator program. There is a concerning trend in Massachusetts with the closure of several maternity units across the state, including Holyoke Medical Center, Falmouth Hospital, and Toby Hospital, as well as inpatient psychiatric units in Holyoke, Natick, Westwood, and Lowell. Additionally, the restriction of midwifery services at Cape Cod Hospital from 7 p.m. to 7 a.m. has limited patients' right to choose their care provider and delivery experience. Now, citizens from the Cape have further to travel for delivery and pre- and postnatal care and are prevented from choosing an advanced practice nurse as their healthcare provider. Is Massachusetts creating healthcare deserts through hospital closures, consolidations, especially in maternity care and mental health?
I hope not on mental health. So let me do mental health first, and then I'll go from mental health to maternity. So we have seen the loss of about 270 psychiatric beds over the course of time in Massachusetts, not just from the flooding of Norwood Hospital, which had about 66 psychiatric beds, but the closure of Providence Hospital in Western Massachusetts, and during COVID, a number of psychiatric hospitals or units within a general hospital of reducing their physical capacity, their staffed capacity, in order to provide better cohorting of patients as well as physical distancing. So some of the decline is temporary, I hope, once we get through the other side of COVID. We have a very intentional initiative right now that will add probably about 250 psychiatric beds across the lifespan, and including some specialty beds from now to about July, including paying for some of the capital costs if you can open by a certain date. There's a little incentive here. Can't wait for 3 years. So there's an incentive if individuals can open up some beds quicker, plus both on the development side, the capital side, and the operating side. So I'm expecting a number of psychiatric beds to come online, from children to adolescents to adults to older adults, as well as some specialty units, particularly around kids on the spectrum, where we know we have a very high need. And we've seen a 5-time increase in what we would think of as psychiatric boarding in emergency rooms. It ranges a little bit. So we have, you may know, since you obviously are studying this, we just did, I directed or authorized, whatever word you would like, the Department of Public Health to have an expedited determination of need process for psychiatric beds. Again, not just like expedited. And so Metro West just had their determination of need approved. Cambridge Health Alliance just opened some beds at their main campus, and the Somerville campus, if you know, depending if you know how well you know the state, the Somerville campus is going to be opening about 60 beds as a wraparound to their license. Mass General Brigham bought the old Middleborough campus from High Point, and we'll be wrapping the McLean license around that. So we are deliberately opening up a number of psychiatric capacity in the Commonwealth, including co-occurring illnesses of psych and addictions. I don't know when we sort of divorced some of this stuff, you know what I mean? So that's one. On maternal health, it's a little more complicated in the sense of we've seen a 27-28% decline in births in Massachusetts since about 2000, might be even a little bit before 2000. So some of the consolidation of units is a natural reduction based on reduction in maternal health across the state. The positive about Massachusetts, and I know this is a little bit of a mixed message, is we are the third densest geographically densest state in the United States. So we are compact in the sense of density. So you can get from place to place. And I understand that it creates challenges for individuals. But the good news is we are sort of a compact state around distribution of beds. I do think it is an issue where we need to ensure we have sufficient geographic access for women, and as opposed to sort of the free market. So we have the free market sort of consolidating, and I do think we need probably some regulatory reforms to ensure we have access across the state. I will tell you honestly, I did not know, so you did stump the secretary. So I did not know about the midwifery issue at Cape Cod Hospital, and I need to talk to people about that. So I appreciate you raising that to me.
Thank you.
Thank you.
Thank you, Gina. Thank you, Secretary Sudders. Good evening. My name is Laura Duff, and I am an active member of our Health Policy Committee. I am a registered nurse at
I know your name from the healthcare policy advocacy space.
Oh, wonderful. Pleasant surprise. I also work as a nurse at Beth Israel Deaconess Medical Center. I'm on a cardiac intermediate care unit, and then I'm also pursuing my DNP at UMass Amherst in public health nurse leadership. So unfortunately, this pandemic has brought to the forefront some of the critical gaps in resources across the Commonwealth, specifically when it comes to long-term care settings. Proposed regulatory changes include setting a minimum number of hours of care per resident per day at 3.5 hours, of which at least half an hour must be care provided by a registered nurse. The facility must provide adequate nursing care to meet the needs of each resident based on acuity, resident assessments, care plans, etc., which may necessitate staffing that exceeds the minimum required hours per resident per day. Recently, ANA Mass provided comments that supported these amendments, as collective results from multiple studies identified that improved staffing in long-term care yields improved outcomes. Our questions for you after that explanation are: what are our next steps to support the nurses and nursing assistants who practice in long-term care? And how do we protect our elders? And then how can nurses at the bedside in these settings be empowered as the decision makers and have access to resources needed to protect their residents and themselves?
So first, thank you for commenting on the proposed regulations. And let me just give you a heads up. Because of the amount of comments that came back, as you can imagine, they're actually coming back out for a short period of comments again. So I would just, so this is just a heads up, you will see them soon. We will not change the hours per patient day. And quite honestly, I was dismayed that that actually had not been in regulations before. That there was an expectation about how many clinical hours per patient day should be an expectation in Massachusetts. There's no question that the pandemic has disproportionately impacted both communities of color and our older adults. 64% of our deaths are attributed to individuals over the age of 65, and primarily people in nursing homes. We have invested about $400 million in a financial and accountability package. So finances to increase rates, to address infection control that clearly the CMS surveys, while it asks questions, I think whether it was just a paper response, or I'm not sure how strong infection control was within a number of our nursing facilities. That's certainly a pandemic just exposed significantly. The PPE, my favorite 3-letter word as I refer to it, right? PPE, which in hospitals, right, how you don on and off is almost second nature. One of the things we discovered early on in our nursing facilities, again, this is no blame, it's just like the things you discover, was the level and sophistication of use of PPE was not strong. And that's been a whole, aside from getting a lot of PPE, of just the process. So now we require in our nursing facilities a coach to help, right? Train and coach, just coach. Here's how you don, here's how you doff PPE so that we're not spreading infection control. I could go on, which I won't, about the things we've done since March to really address what I would say were probably longstanding inequities in our nursing, we have 40,000 nursing home beds in Massachusetts, 379 facilities, which I think I could probably name them all. We imposed freezes, admission freezes, which we had not done before. And I'm certain that there's some in the nursing home industry feel like I've sort of run over them in some of these things, which I feel strongly about. Dealing with the pandemic, we've done, I think, a couple of good things. One was we were the second state to put in place mobile testing. Maryland actually started it, and I took a page from their playbook, and they started it because one weekend, 11 nursing homes in Maryland closed their nursing homes and sent patients to their emergency departments in and around Baltimore. And that weekend, they had the National Guard come in to do basically mobile testing and mobile supports. And I had been talking to my counterpart in Maryland, and I was, the last thing I wanted was nursing homes completely collapsing and sending all their patients and overwhelming already, as you know, stretched nursing homes at the height of the first surge. And so we mobilized the mobile side of the National Guard to do mobile testing, and then expanded that to using ambulances to do mobile testing at our nursing facilities, and then expanded the National Guard and then a private company to do what we refer to as rapid response teams at our nursing homes who have a cluster and then can't staff nursing and CNAs and the like. So we have 24 rapid response teams. That is basically an entire unit staffing. So if there's a cluster or it's different in the fall than it was in the spring. So we literally send out 24 teams based on the number of positive cases, staff call outs to Massachusetts nursing homes to just really help support the nursing staff and the CNAs who are there, boots on the ground. The regulations are the future. So around hours per patient, the cohorting of patients, this physical space size of, we've had longstanding regulations of grandfathering facilities that were created prior to, I want to say 96, but it might actually be sooner than that. And so we're really trying to help the industry reform to take care of residents in the future. I also think better providing supports for people to age in community is part of the work we've been doing with the Governor's Commission on Optimal Aging, which seems now like a lifetime ago, given the past 10 months. So we have a lot of work to do together to support our older adults in nursing facilities. I think we are starting now on a good path forward, and the regulations are one step in that direction. Oh, the other thing I would say is the financial and accountability package required that 75% of the rate increase of the rate had to go for direct care salaries, which we don't usually do in government, but human services and healthcare, our widgets are our people, the people providing the care. And I'm not saying widgets in a disrespectful way, right? But it is our support and care of people that matters. And so we put in a requirement that 75% of the rates had to go for salaries, direct care salaries. And we audit that. And that was an important piece of our messaging, that direct care staff matters, turnover matters, retention matters, supports matter, career ladders matter. So I was not, it was, I know all of you would agree with that. It was not as easy as, you know, as people think it is, but it was a very important statement from us. And I'm not reneging on it.
Thank you so much. And yes, we do agree with you. So thank you so much. We appreciate it.
Secretary Sudders. Historically, children who have experienced pandemics are 5 times more likely to require mental health services and experience higher levels of post-traumatic stress. Social isolation, such as occurs in quarantine and remote learning, is associated with an increased risk for depression and anxiety. The financial instability associated with increased unemployment rates can result in an increased risk of domestic violence and abuse, and in turn, adversely affect a child's development. Yet, reporting of child abuse and neglect in Massachusetts has dropped by 60%. Youth from low-income households who have public insurance or are from racial ethnic minority groups are more likely to receive mental health services exclusively from school settings. Yet, school closures may have a disproportionately limited access to mental health services for this subset of students. So our questions are, what steps is the Commonwealth taking to protect our children? And what can ANA Mass do to assist, given that schools are closed? School nurses are now also supporting COVID-19 in terms of contact tracing, public education, and vaccine efforts. And what efforts or resources can you foresee would be needed in the future?
So I'm glad you really asked me the easy questions tonight. The effects of this pandemic on the emotional health of individuals, and particularly kids and others, we will be experiencing for years. The anxiety, the depression, post-traumatic stress, social isolation, is remote learning, as all those things you say, fear of germs, phobias, right? We do not yet know what the impact is going to be, but we know there will be an impact, not just on situational mental health issues, but also for individuals who perhaps have a significant mental disorder, but yet has not been triggered, could be triggered. So we have tried very hard to not have schools close in Massachusetts. We believe actually in-person and hybrid learning is very important for both educational and social and emotional development. You may have, I think it was last Friday. It really is like one long day since March, so never trust me on a date. We announced pooled testing at the state's expense in order to help schools reopen to do surveillance testing, PCR surveillance testing. The good news is, so my numbers were as of this morning, they might have changed. 140 school districts in Massachusetts have signed up for pooled testing for exactly the reasons of getting kids back into school. We also know the more eyes on kids, right, the better. And schools and physicians are the individuals for whom file see children and are the ones who file what we refer to in Massachusetts, right, our 51As, our child abuse and neglect. And I've watched the numbers also, the 51As drop precipitously. So 2 things. One is when we started to reopen Massachusetts in May and June, and then this fall as we started to retrench, one of the things we did not retrench on was preventive medical care, pediatric care in particular. I talk a lot about that, the governor's press avails. We want kids to go to their doctors, to be seen by doctors, to be treated by doctors and the like. So we did not close, we have not closed outpatient ambulatory services like we did in the springtime. In the springtime, we just like shut everything down except for basically emergency and inpatient COVID care. And that's very important to us for kids to start to be seen, right? And then the second is really trying to have schools open. I mean, the educational attainment for kids, I mean, I just can't imagine what that is like, as well as having kids in classrooms with teachers and with other, hopefully caring adults, right, to support them and for us to nurture them. And so pooled testing, so I had, you would think this is the Department of Education and secondary education. So I have several staff who work with me. This is the command center side of Health and Human Services, actually have become experts on how to roll out pooled testing. And the few organic pilots that existed in Massachusetts, we took the learnings from that and have put out a statewide opportunity. And I think tomorrow is Tuesday. Tomorrow is the webinar with our with school nurses, with superintendents, and with teachers to really try to open up our schools again safely, and with teachers, staff, and administrators and kids all being tested through surveillance testing. So that is part of what we're trying to do, is to reopen and keep our kids safe. I worry about this a lot. The other thing we're doing is, actually, I just briefed the governor today, is we've been working on a behavioral health roadmap on the acute side. So think of like prevention through access to inpatient, not all of behavioral health, but right, urgent care, outpatient access, 24/7 access. And we will be unveiling the behavioral health roadmap, which got a little derailed by the pandemic, very soon, and would welcome the ANA's participation in these conversations, very much so. And I will make sure that you get the links and the opportunity to work with us on it.
Well, we appreciate the consideration.
Oh, absolutely. It's a blueprint subject to change as we understand dynamics. And a big piece of it is around the workforce, and to have a workforce that represents the richness that is the diversity of Massachusetts. So equity has a big lens in this as well.
That's wonderful. So I do want to just do a quick time check. I want to be respectful. It's about 5:40. We have many more questions, but can certainly wrap up here if you are pressed for time.
I have a call in a few minutes. I'm sorry.
Okay. Oh, that's okay. So we'll wrap up, and I've been taking notes as we're going, and some of these initiatives are incredible. So I'm hoping that you could just share for our viewers at some point how to access the dashboard that you referenced for the equity piece around vaccinations, and then so exciting and just thrilled to hear about the 250 psychiatric beds. That's going to be an incredible help. I mean, as you know, our emergency departments are just completely inundated. So so many issues, and we really appreciate you advocating for all of these. I don't know if you know, but your staff assistants have offered to answer some of our questions that we didn't get to around opioid crisis, public health nursing. So we may send you those offline, but we really appreciate all of your time. I think just briefly, if I could close with this, 2020 was the year of the nurse, and it was certainly one that no one expected. So just in closing, how can you tell us just briefly, how do you feel as Secretary of Health and Human Services, you or we might be able to help elevate nurses to be at the table in these decision-making possibilities, I will say, around pandemic response and vaccine distribution, long-term care regulations. I know you just offered to have us help you weigh in on that initiative, which is wonderful. We're happy to do that. But any just final thoughts you have around elevating nursing to be at the table when these decisions are made?
So 2020 was the year of the nurses, and in many ways it was the perfect year, because nurses are the bedside in a pandemic and every day. And we've asked a lot of nurses, but honestly, every year should be the year of the nurse. I say the same thing about social work. It's like, you can't run hospitals, you can't run healthcare without nurses. We would welcome the ANA on any level of engagement that you would like to be involved. Whether it's, we're about to, I can't even believe we're about to renew our big Medicaid waiver again. And it has equity as a lens. It has behavioral health, primary care as a lens. So would welcome, we have more listening sessions, but really like active, like we will make sure you are on all of our distributions for inviting in comments, because as I often say, yes, do I make the policy? Do I make the decision? Yes. but I'm not making decisions alone on the 11th floor of One Ashburton, that it has to be a community process, because those are the best policies of taking in all the inputs and then trying to find that path forward. I would just offer that to you, because you can always hit the delete button if it's an issue that, you know, you would say is not front and center for you. And then last thing, let me just, so we published the vaccine, we published a dashboard, and Colleen will send the link weekly.
Okay.
It will become part of the interactive, we put out a daily dashboard, as I'm sure many of you know, and it's gone into being, now it's an interactive one. The vaccine, we just started last week. You know, we are only in week 3 of vaccines and or just started week 4 today. So that's a standalone at the moment. By the end of the month, beginning of February, it will become part of the daily dashboard, an interactive one. But right now it's a weekly on Thursdays. And I'll make sure you get the link to that, because it's important for us to monitor our progress going forward. And with that, I wish you health, stay well, practice bubble fidelity, as I refer to it. And we will find our ways through this together. And I'm really grateful to the ANA of Massachusetts. I listen to your advice and I always welcome it. So thank you.
We really appreciate your time. Thanks so much.
Take care. Be well.
You too. Thank you. So for those, just to wrap up, I just want to let everybody know that our next Commonwealth conversations will be in a few months, and we have Massachusetts Attorney General Maura Healey, who will be joining us next. So thank you everyone for your participation and for joining this evening. We look forward to seeing you again, and everyone stay well.